Salim Ismail, a citizen of Zanzibar, a retired professional, presented to us with a 2-year history of tingling numbness of all the 4 limbs, as well as unsteadiness of gait and inability to walk for the last 3 months. It was unfortunate that he has been diagnosed with peripheral neuropathy without even having an MRI. But after we investigated him, he was found to have ankylosing spondylitis of the spine with pseudarthrosis at C3-4, along with the cervical disc prolapse at C3-4 and myelopathy associated with that. And also he had a degenerative lumbar spondylolisthesis at L4-5 and canal stenosis at L5-S1.
My name is Salim Ismail Kunduru. My country name is Zanzibar, which formed the United Republic of Tanzania. My country, Zanzibar, lies along the East African coast, 6 degrees south of equator. My big problem was the spine. I went to several hospitals in my country, including Dar es Salaam, but I didn't get the proper medication. So I decided to find another hospital which can help me to arrest the situation which I'm having. So I appealed to my government to help me. So the government decided to send me to Manipal Hospital. By that time I didn't know what is Manipal Hospital, but through internet I came to understand what is Manipal Hospital. And now I'm here, I know that they are speedy, they are quick, they are fast, and they are caring for the patients. So I admire them.
Here are some of his cervical spine X-rays. You can see that there are fused vertebrae in the lower cervical spine, and the place where the lower cervical spine joins with the C3, there is a pseudarthrosis and the disc has come out and is pressing on the spinal cord here. These are the radiographs of his lumbar spine, which look apparently normal on his standing radiograph. However, we got a surprise when we did his dynamic standing forward flexion X-ray, which showed the L4 vertebra to be slipping on top of the L5 vertebra. And here is the MRI showing the lumbar canal stenosis at L4-5 and L5-S1. We did take him up for a major surgery. First we did an anterior cervical discectomy and fusion with a cage and a plate at C3-4. Then we flipped him over, did the posterior spinal surgery of fixation from C2 to C6, and then we went on to his lumbar spine and did the posterior lumbar interbody fusion by realigning the bones and fixing them with the screws and replacing the disc with the artificial cages filled with local bone grafts. Finally, the surgery took around 8 hours and the patient withstood the surgery very well despite losing 900 ml of blood. He had good physiotherapy after surgery and was discharged after a week of surgery, and he was able to stand and walk few steps with support after 2 weeks of surgery. He is still around with us taking good physiotherapy, which is the key to his success in the long run. We expect him to get the full recovery in the next 1 to 2 years of time, as he had presented to us late and the problem had not been diagnosed early. If it were to be diagnosed early, I am sure he would have been playing football again right now.
My doctor, Dr. Vidhyadhara, is a good doctor. I can say. He's very charming, very caring. He taught me everything before the surgery done. When I'm going to the surgery, I know what is going to happen. You know, I like him. He's a good doctor. All the staff from the Manipal Hospital are very nice, very caring to the patients, even international relation desk. They are very good, they are very caring. They are not tired of answering phones from the patients. In fact, they are very good. So for me, I recommend Manipal Hospital as the best hospital in India.